to Buchanan County Health Center's video for a total hip replacement. My name is Sarah and I am one of the occupational therapists here at the Buchanan County Health Center. This video is going to show you some tips and tricks to use after and before your total hip replacement here at Buchanan County Health Center. This video is going to include various precautions to use after your hip surgery, adaptive equipment you can use to help get yourself dressed, as well as ways to get around and transfer, as well as exercises your surgeon will want you to perform before and after your surgery. After your hip surgery, there will be 3 different precautions that you will want to be aware of and use in your everyday life. The first one is not exceeding a 90-degree angle at your hip, which includes bending too far forward or lifting your operative leg up too high. Another precaution is turning your leg inward. The last precaution is crossing your legs either at the ankles or at the hips, as these all put too much pressure on the hip joint. The first tool we will use is the reacher. The reacher can be used to help take off your shoes. So, being careful of not internally rotating your leg or leaning too far forward. You want to reach down with the reacher and pull the shoe off. You can do the same thing with the other shoe. Using the reacher, pull your shoe off and set them on the floor, not leaning too far forward in your chair. The next piece of equipment I want to show you is the sock aid. This device helps you put on and off your sock. This device works for large hospital socks as well as everyday socks. To use this device, butt the sock aid up against your stomach. Use both hands to pull the sock all the way up the device. Grab both handles, set the sock aid on the floor, not reaching too far forward. Then you can pull the device up your foot to put your sock on. If your sock is not all the way up your foot or up your leg, you can use the dressing stick and pull the sock up as far as you want. Again, make sure you're not leaning too far forward to pull up your sock. Now we're going to talk about putting on your pants. The biggest precaution is leaning too far forward, as you can't reach down to put your pants over your feet. That is where you're going to use your reacher. Use the reacher to grab the pant. Put the pants on the floor, again not reaching too far forward. Once you can reach them without leaning forward, you can pull the pants up your leg. Do the same thing with the other leg. Once you can reach it, pull the pants up your leg. Be careful not to internally rotate your leg or cross your knees over. The last piece of adaptive equipment I will show you for dressing is called long handle shoe horn. This is to slip on your shoes. Put the shoe horn behind your heel and slip your foot into your shoe. Another piece of equipment that makes putting on your shoes much easier is elastic shoelaces. This way you don't have to continuously tie your shoe, and it makes putting your shoes on much easier. Lastly, I want to show you a long-handled sponge. This is for bathing purposes, as you can no longer reach down to touch your toes and wash your legs. Instead, you have a long-handled sponge to wash your legs, your feet, as well as your back, areas which are hard to reach. After hip surgery, you will have several precautions that you will want to be aware of when going to stand up. The first is not leaning too far forward or bringing your knees too far up. So, in order to get to the edge of the chair, you want to push yourself forward in your chair, then pull yourself forward. making sure your knee is straight out in front. You can then push yourself straight up out of your chair, not leaning too far forward when standing. To sit down, you will want to reach back, find the armrest of the chair, have that leg out, and then slowly sit down. Now I'm just going to show you a run through of how you would stand up. Standing up from your chair is very similar to how you would stand up without the walker. After your surgery in the hospital, you will be using a walker. Push yourself forward, keeping that knee out. You want to use the armrest of the chair to help push yourself up, standing straight up, transferring your arms up to the walker. In order to sit, you want to take one arm off, keeping that leg out, reaching back for your armrest, sitting straight down. Now I'm going to show you how you can just stand up in the hospital using a walker. After your hip surgery, you will have to be careful of how you sit down on the toilet. The main precaution is not leaning too far forward and bringing that knee up. In order to watch those precautions, you want to make sure your leg is out in front of you, you have something to hang on to, and you know the toilet is right behind your leg. When sitting, slowly sit, hanging onto the bar, keeping that leg out in front. In order to stand up, you want to use the grab bar to help pull yourself up, keeping your leg out in front and using the walker. Standing straight up. The next transfer I want to show you is how to get in and out of the bathtub post hip replacement surgery. We're going to say that our right leg is the leg that we had surgery done on. When going back to the bathtub, make sure you have your walker, stepping back, putting weight through that leg. Once you feel the tub transfer bench behind your legs, go ahead and reach back for the tub transfer bench, keeping that leg out in front of you and sitting down slowly. The next step is to swing your leg up over the bench, not leaning too far forward, leaning backwards into your bench, scooting the butt back, and then bringing the other leg in. When getting out of the bathtub, you'll want to do the exact opposite. Start with the left leg, bringing that one over, leaning back, keeping the leg up and straight, not internally rotating that leg, keeping it upright. Scoot yourself to the edge of the chair, not leaning too far forward. Grab the walker, and then stand up.
Hi, my name is Rundy. I'm a physical therapist here at the hospital, Buchanan County Health Center. We're going to show you transfers in and out of bed following hip surgery. Your affected side or your surgical side is going to be your left leg today, your left hip. So what I would like you to do is go ahead and position yourself about a 45-degree angle, as close to the handrail as you can, or as close to the pillow in bed as you can. You're going to bring this affected side, the left leg, up into bed. You can assist with your hand if you need to, onto the bed, making sure you remember your 3 hip precautions. Do not go bend too far forward past a 90-degree angle at your hip. Do not turn your toes inward this way, or do not cross midline or cross your legs. In this position, she is going to then bring up her right leg and follow, making sure her hands are behind her on the bed. She can position herself into the center of the bed, and then once she's there, she may lay back. Now, I'm going to switch. We're going to keep the left leg as the operative leg or the affected side, and we're going to get out of bed towards the affected side or operative leg. Now again, we are going to be getting out on the left side of the bed, going towards your operative leg, as this is her hip she had surgery on. What you're going to do, if able, the patient is going to come up onto their elbows. Another option is also reaching across with your opposite side arm, reaching towards the handrail. You can bring this left leg across slowly. You can also scoot that right leg next to it, and then just keep working your way towards the edge. Coming up, weight onto this left elbow, pushing up onto the hand, keeping your hands in contact. Bring your right hand and your left hand behind you, continuing to put weight through your arms and scooting your legs around until you're square with the edge of the bed, and then bringing your hips up, pushing your bottom towards the edge of the bed, placing your feet flat on the floor. Keep your hands on the edge of the bed for balance. Now we're just going to show you how to get in and out of bed following surgery for your hip. Left hip is my affected side. These are the exercises that we are going to emphasize for strengthening prior to your hip or knee replacement. First, we're going to start with ankle pumps. You can place a towel roll underneath the ankle just for ease of range of motion for the ankle. This is mostly to emphasize range of motion as well as circulation through the lower extremity to help with swelling and edema post-surgical as well. What you want to do is gently bring your toe up and then point the toe down. Going as far as you can, up and down. Slow and controlled is important. Now, do them with me. Up, down, up, down, up, down, up, down. We encourage you to do at least one set of 10, 3 times throughout the day in a slow and controlled manner. Next one, we're going to go ahead and lay down glute or buttocks squeezes. What you're going to do is lay flat on the bed. You're going to tighten your buttocks muscles, only your buttocks muscles, keeping your front and back of your thighs relaxed. Hold for 5-second count and then release. Again, 1, 2, 3, 4, 5, and relax. Go ahead and do them with me. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. We'll do 2 more. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. And it's important to hold that 5-second count to get a good muscle contraction for the pure strengthening and neuromuscular portion of the exercise. Now you're going to keep laying on your back flat on the bed. We're going to work on the upper thigh muscle. We're going to take the towel roll. You may move that underneath your knee if you wish, or you can leave it under the ankle. Completely up to you. Behind the knee might be a little bit more comfortable if you have a hard time keeping that knee straight. Again, you're going to lay down. You're going to tighten the muscle on the upper thigh, pressing the back of your knee down into the towel or the surface underneath you on the bed. Hold for 5 seconds and then release. Again, tighten. 1, 2, 3, 4, 5, and relax. Again, 1, 2, 3, 4, 5, and relax. Go ahead and do them with me. Push down, tighten the upper thigh muscle. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. Let's do 3 more. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. Again, emphasis is to really work on holding that 5-second count. I will encourage you to do 1 set of 10, 3 times per day with the 5-second count each repetition. The next exercise is short arc quads. This will work the lower part of the upper leg to help straighten the knee and strengthen around the knee. What you're going to do is have a bolster underneath your knee, laying flat on your back, with your leg and the back of the leg in contact with the bolster at all times. You're going to straighten your knee, lifting your foot off the bed, holding for a 5-second count, keeping your toes pointed towards the ceiling, and then slowly return to the starting position. Lifting the foot up, toes towards the ceiling, hold for a 5-second count, and then slowly return to the starting position. Go ahead and do those with me. Lift. 1, 2, 3, 4, 5, and slowly return. Again, lift. 1, 2, 3, 4, 5, and slowly return. 3 more. Again, lift. 1, 2, 3, 4, 5. Slowly return. Lift. 1, 2, 3, 4, 5. Slowly return. And last one. 1, 2, 3, 4, 5. And slowly return. Again, keeping the numbers the same, 1 set of 10 repetitions, 5-second hold, 3 times per day. Next one is going to be the heel slide. Emphasis will be for range of motion. Go ahead and lay on the back of the bed. This one may be a little bit difficult for hips if there's increased pain, but go within a range of motion that you can tolerate, because the range of motion is still important. Go ahead, you're going to slide your heel towards your bottom, bending at the knee and the hip. Bringing your heel towards you, or towards your bottom, and then slowly return to the starting position. As you can see, I'm having a little bit difficulty with my shoe on the bed. It will be easier with socks, or you can also place a bag over your plastic bag over your foot for increased ease of gliding that foot along the bed. As high as you can, heel towards your bottom, and then slowly return to the starting position. Making sure you keep that foot in a neutral position with your toes pointed towards the ceiling once you return to the starting position. Go ahead and do that with me. Heel towards your bottom, bending at the knee and the hip. A range of motion that is comfortable for you, and then slide all the way back to the starting position. 4 more there. More. 2 more. And last one. Important to remember to make sure you do not cheat yourself on either end, bending as far as you can comfortably and return to a straightened position as best as you can. Next one is going to be the straight leg raise. You're going to bend the opposite leg that you are not going to perform the exercise with. This is to help assist with your back. You're going to tighten the muscle on the top of the upper thigh, keeping your toes pointed towards the ceiling, and then lift the leg. No higher than this other leg or the bent knee. Hold for a 5-second count, and then slowly return back to the bed. And completely relax the leg. Again, tighten the upper thigh muscle, pushing your knee down into the bed, toes towards the ceiling, and lift. No higher than the other knee, bent knee. Hold for 5 seconds, and then slowly return back to the starting position. Go ahead and do those with me. Let's do a set of 5. Tighten the thigh, toes up, lift. 1, 2, 3, 4, 5, and come back down and relax. Tighten the upper thigh, toes up, lift. 1, 2, 3, 4, 5, and then come back down. Relax. Tighten the upper thigh, toes up, and lift. 1, 2, 3, 4, 5, and then come back down. 2 more. Tighten the upper thigh and lift. 1, 2, 3, 4, 5, and slowly return and relax. And last one. Tighten down, toes up and lift. 1, 2, 3, 4, 5, and then come back down.
Hi, my name is Ann, and I'm going to be one of the nurses taking care of you. This next exercise we're going to work on is the hip abduction and adduction. So the first thing you're going to want to do is lay down flat on your back, and you want to keep your toes up and your knees straight. And we're just going to pretend that your right leg is your operative leg. So for this exercise, you're just going to take your leg out, keeping your toes up and your knees straight, and holding it for 5, and then back in. And you'll do this 5 times. 1, 2, 3, 4, 5. Back in. Just always remember to keep your toes up and your knees straight. And take your leg out as far as you can. And 1 more.
Now we're going to do some seated exercises. You can either sit at the edge of the bed or in a chair with a back. So I'm going to show you in the chair for some support for your back. Okay. When you're sitting here, you're going to work the upper thigh muscle and a larger range of motion, which is different from the short arc quad you did earlier. What you're going to do is keep your leg resting on the chair that you are sitting in. You're going to take your foot and kick out just like you're kicking a ball. Straighten the knee as best as you can. Toes up towards the ceiling. Hold for a 5-second count. And then slowly return to the starting position. And again, all the way up as best as you can, just like kicking a ball. Toes up, 5-second count, and then return. Let's do those together. Let's do a set of 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Again, kick up, toes up. 1, 2, 3, 4, 5. 2 more. 1, 2, 3, 4, 5. And last one. 1, 2, 3, 4, 5. And relax. Now we're going to show you the sitting knee stretch for straightening of the knee. What you're going to do is either have a footrest or a chair in front of you in the chair that you're sitting in. You're going to lift the leg up onto that chair comfortably, basically stretching the hamstring and or the gastroc and the back side of the affected leg. If you can start out holding this up to 30 seconds, that would be optimal. You can hold it anywhere up to a couple minutes, even up to 5 minutes. But I would suggest starting out 15, 20, 30 seconds, what you can tolerate, and then coming back down off and giving yourself some relief. You can do this one set of 10 repetitions for that 15, 20, or 30 second hold to what you can tolerate, emphasizing mostly the stretching behind the knee and the back of the leg. So again, lifting that leg up, resting it on the chair, relaxing all the muscles in the leg, feeling a stretch in the back part of your calf and the back part of the upper leg, and then coming back down. Let's do at least 2 or 3 of those, okay? We will do like a 10-second hold, just for time's sake. Bring the leg up, place it on the chair. Toes are going to be straight towards the ceiling. There's 10 seconds, and then coming back down. Coming back up, hold up there, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then coming back down. The next one we're going to do is seated knee bending. This again is for range of motion in a sitting position. You can scoot towards the edge of your chair with your armrests. Your affected side, you're going to start out in front of you. It's going to be similar to the heel slide that we did lying down. You're going to take your foot pointed straight forward. You're going to slide your heel back towards the chair as if taking your heel underneath your buttocks. Go as far as you can comfortably till it's that threshold where it starts to just get uncomfortable. Pause, and then return to the starting position. Okay? For the holds that we want you to try to do again, just like we did for the straightening of the leg stretch, we want you to bring it back, hold for 15, 20 to 30 seconds, and you can work up to that to where that threshold just starts to get a little uncomfortable. Hold it there for that 15, 20 or 30 seconds. And then you're going to straighten back to the starting position. Let's do a couple of those. We'll do a 15-second hold. Slide your heel back, keeping your toes straight forward. Heel's going to go underneath your buttocks. Hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and then relax to the starting position. One more time. Slide your heel back towards the chair underneath your buttocks, keeping your toes facing straight forward to that position where it starts to just get a little uncomfortable. Hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then return to the starting position. Last one, chair push-ups. You're going to sit in a chair with sturdy armrests. Your hands are going to be on the armrest. You're going to straighten, place your feet slightly in front of you, shoulder width apart, toes facing forward. You're going to straighten your arms, pushing up, making sure not to go too far forward at the hip, and you're going to push up with your legs and your arms, and then coming back down. You are not going to completely stand up. You're going to basically keep your hands in contact with the armrests. Again, straighten your elbows, push up through your feet, legs and arms, and then coming back down. Come back up. And then coming back down. Now we're going to do a set of 5. We're going to hold for a 10-second count at the top. So we're going to go ahead and keep our feet shoulder width apart, toes facing forward. Hands are going to be on the armrests. You're going to push from the armrests, straightening your elbows, pushing through your legs, your feet flat on the floor. Hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then coming back down. Again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Notice I'm not going too far forward, bending at the hip and maintaining a nice tall posture, an erect posture. Push from the hands and the feet. Hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 2 more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And last one. Push through the hands and the feet, straighten the elbows, hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Hi, my name is Melissa. I'm one of the respiratory therapists here at Buchanan County Health Center. After surgery, it's going to be very important for you to keep your lungs healthy and to prevent pneumonia. While you're here in the hospital, there are a couple techniques that we are going to be showing you how to use. And we would like you to get started using those while you're at home before surgery, so that when you do come for your surgery, you'll be all set and ready to go. The first is going to be cough and deep breathing, and to perform that, you are going to breathe in through your nose slowly and deeply till you are all the way full. You'll hold your breath for 3 seconds and you will blow it back out. Again, you will breathe in through your nose slowly and deeply, holding your breath for 3 seconds, and then blow it out completely. Again, you will take that big deep breath in through your nose. This time you'll hold it for 5 seconds and you will cough it out. All right, and we will practice that. So you will take your big breath in through your nose, hold it for 3 seconds, and blow it all the way out completely. Again, you will take your big breath in through your nose, hold it for 3 seconds, and blow it out completely. This time, breath in through your nose again. You'll hold for 5 and cough. You'll want to be sure that you perform that every 1 to 2 hours while you were awake. Secondly, we will be working with an incentive spirometer. You will make a nice tight seal here with your lips. You'll take a big, slow, deep breath in through the mouthpiece. You'll want to take it slow enough so that the indicator here stays between the arrows, but this column also rises here. So you'll take a big, deep, slow breath in. You will hold your breath, and then you will blow it back out. And I will demonstrate this for you while we practice here. So make that big, deep breath, or take that mouthpiece in your mouth, and a big, deep breath. It'll also be very important in pneumonia prevention that you do some walking, changing your positions often, and be sure that you are using great oral hygiene.